Good morning, everyone. This is Melanie over at AgentLink. Thank you so much for joining us this morning. We are all excited to hear about what the heck an ICHRA is today. We're going to give everybody maybe 30 more seconds to finish logging in, and then we will jump right in and get things started. Thanks for your patience. Give us just a couple more seconds. Alrighty, we'll let those late stragglers just come in when they may. Again, thank you all so much for joining us today. This is Melanie Karam over at AgentLink. We are excited to have Kelsey Frizzell and Matt Bowden, sorry, missed the D there, Matt, with Remodel Health. And they are going to go over some exciting new options that maybe you guys have never even known were available to you guys. One quick housekeeping thing. The one thing I don't like about this platform is that they cannot see the questions as they come in. So I will be monitoring them, and if there's any technical problems, I'll be sure to interrupt. But otherwise, we'll just hold the questions till the end. Feel free to type them in as we're going through the webinar. Just know that they won't be answered until the very end. So hold on, and we will make sure all the questions get answered at the end. Thank you so much. And Kelsey and Matt, go ahead whenever you're ready.
Perfect. Thank you, Melanie, and thank you everyone for joining this morning. Like Melanie said, my name is Kelsey, and I am our account executive for the Midwest region. And then Matt, I'll let you introduce yourself.
Yeah, good morning. Thanks so much for hopping on. We're excited to walk you through just the Remodel Health ICHRA, what that looks like. I am our Director of Sales over broker and agency partnerships. So I help just work with AgentLink and a lot of health insurance brokers across the United States, just deliver and find creative solutions for their clients. And ICHRA is one of those creative solutions that we help navigate.
Perfect. Yes, and we're excited that so many of you are joining from across the country today. This is relevant no matter where you live. This is nationwide solution. So today we'll cover 4 main topics around the ICHRA solution, and then we'll end with some next steps for you all and a special AgentLink specific incentive for you as well.
Excellent. So this really is the mission of Remodel Health. We want to leverage and utilize individual plan solutions to build a better benefit solution for employees and the employer at a lower cost to the organization. That in a nutshell is what we are aiming to accomplish and what Remodel Health has done really since the beginning of our organization back in 2015. So we were actually founded in 2015. We are headquartered out of Indianapolis, Indiana. Our 2 co-founders are former United Healthcare executives. They've spent their entire careers in the health insurance industry. And after the inception of the ACA, they thought there has to be a better alternative, or at least a different plan option for employers when they're helping evaluate their group health insurance renewals year over year. So as a company, we have 120 employees. We've seen pretty rapid growth, rapid expansion. I myself have been with the company actually since the very beginning. I was our second employee. I've sat and kind of lived in the sales and the delivery of our solution since I began. Kelsey's background with Remodel Health, she's actually lived in our customer success roles. She's lived in our implementation specialist and now as an account executive. So she has just a tremendous amount of knowledge. So we're excited to be here and kind of talk through what this looks like for you. But as a whole, our company serves 4,000 organizations across the United States. We currently operate in about 40 to 42 of the 50 states. And cumulatively, we have over 100,000 members served on our platform. So as Kelsey mentioned, this is not geographic specific. This is not a size of group specific product or solution. We really see this model working for organizations of all sizes, and will help you better understand what type of group or what industry or who that group might be that would be best served through this ICHRA solution, ICHRA product. really helping you understand what we are doing. This ugly acronym ICHRA, you'll hear it probably 30 more times on this webinar, but it's a newer law, newer legislation that was put into effect. It was passed in 2019, went into effect January of 2020. If we scale back, take a step back and not reference health insurance for a second, what is being accomplished using an ICHRA is very similar to the world that we've already seen shift from pension plans to 401ks. So that shift that took place in the 70s, 80s of organizations largely moving away from pensions and into more of a defined contribution model, leveraging 401ks or 403bs, is a very similar type shift that's taking place in healthcare. So through this model, we actually see, using an ICHRA, the exact same concept coming to fruition, where organizations are tired of their annual rate increases. They're tired of that guessing game of what are we going to get this year? Is it going to be a 10, a 20, a 30%? And they're done with that downward spiral of just group renewals. And that's true in the small, large group, fully insured, self-funded space. So rather than the employer being responsible for that decision, the employer and the group being responsible for those renewals and increases every year, what's taking place is we are shifting to a contribution model or a budget model where the employer defines a dollar amount or a monthly allowance that they can now give to their employees. That the employees have access to these funds, and then they get to utilize Remodel Health Services to pick and choose the best individual health insurance plan for their specific needs. So just like in a 401k, where the employer gives a contribution, and then they might use Fidelity's services. They get Fidelity's app, they get their customer service, their compliance and technology, their investment specialists. That's exactly what Remodel Health is offering, is the technology, the support, the compliance, the one-on-one benefit consultations. So we really package it together to look, to feel, to function like a group health insurance plan, while now leveraging more choice and more options while still utilizing funding from the employer for those individual options. So we jump into what is an ICHRA. Again, we've mentioned this acronym. What it stands for is Individual Coverage Health Reimbursement Arrangement. So as the name suggests, you are reimbursing individual health plans through this employer contribution. Then this is fully compliant. This is built into the legislation to allow employers to now fund individual health plans through your state or the marketplace within your state, or in off-exchange plans, which means essentially you're enrolling directly through the carriers that are available within your state. So this is a qualified pre-tax group health insurance plan. I don't know how familiar you are with the individual market. There used to be something called a ICHRA, and that was for qualified small employers, and there was a health reimbursement arrangement very similar to the ICHRA. The ICHRA actually opened up more flexibility with who it can be offered to, how it can be offered, and how you can develop the budget. The biggest difference between the two is that we actually saw it shift up market. So you can use and leverage this ICHRA solution for large employers, and it checks the box of the employer mandate, because groups are over 50 full-time eligible employees are required to offer minimum value and minimum essential coverage. So this checks that box. It is a qualified group health insurance plan. So that's a huge win for large employers, but we actually see a large portion of our clients living in that small group as well. So really, Remodel Health, where we see this solution working the best is employers from 10 to 500 employees. Is typically where the ICHRA makes a lot of sense. And really the benefits of why we use an ICHRA is because now you get access to be able to leverage pre-tax dollars from your employees. So it's still a pre-tax benefit or tax exempt from the employer's portion. So, and then once the employees receive those funds pre-tax, any dollar amount that they spend above and beyond what their employer provides them can also be pre-tax. So it's a huge tax advantage. You're not just going out and saying, here's $500, good luck, you're on your own, go find your own individual plan. It is a pre-tax group health insurance chassis that we're leveraging. You no longer are battling with participation requirements. So if you have an industry or a group that might have 200 eligible employees but only have 20 on the benefits, well, no carrier wants that risk. And they probably are in this everlasting cycle of bad increases. Well, with an ICHRA, we're disbanding the group health insurance plan. We're taking a step back, looking at it through a completely different lens, and we are no longer constructing a group product. They're on their own individual plans with tens of thousands, if not hundreds of thousands, of other state residents within the state in which they live that are also participating in these individual products. So the carriers don't even know that they are a part of a group. Remodel Health does not require any participation because we're essentially that third-party compliance, technology, and service company that's helping leverage the solution. So that's a huge win for groups that are battling with those participation struggles. Individual health insurance plans, as you may be familiar with, are all ACA backed, and ACA kind of follow the ACA legislations. So they have the same mandates, the same coverage as your fully insured group health insurance plans. So they're all guided by the same law. So they cover your major medical, your preventative, your emergent services, prescription. So all medical events are covered. There's also no discrimination. So they are all guaranteed issue plans that in no way do any health underwriting. They do not factor in your pre-existing conditions, which is a huge win for individuals that might be going through challenging life circumstances when it's related to their health, but also for the group as a whole, because you're not in this environment where your group is medically underwritten or experience rated on a year-to-year basis. And then we mentioned it talks about how it's a qualified group health insurance plan. And then one of the biggest and kind of most exciting solutions around this is the stabilization of cost and health risk. So really our two goals, and if you're interested in evaluating ICHRA for any clients or prospects, we're more than happy to take a look at that for you. Our two initial goals are how can we drive a similar or equivalent benefit structure while simultaneously showing cost savings. Those are two really big wins. Anytime you can go to one of your clients and say, hey, great news, we're accomplishing both of these goals. The third part that probably goes understated is the ongoing cost stability year over year. So, and that's one of the benefits of why we use an ICHRA. And we actually have some slides that kind of talk through some of those rate trends and what that looks like as well. So we talked about the individual policies, just some of the benefits of those, but the guaranteed issue is really the biggest one of just no underwriting. There's no health underwriting, no health questionnaires. It's solely based on your age, your household size, or the number of people that participate from your household, and the zip code in which you live are the three demographic questions that get asked when you enroll in individual health insurance. So you can't be denied coverage. You cannot be given a rate increase when you first enroll in individual plans or year over year. All of the rates are fixed and they're set based on the zip code in which you live, and every carrier has its own autonomy to give their own rate increases year over year. But there are probably 50 to 75 plans in any given zip code that you have access, and your employees would have access to pick and choose the best carrier, the best product, the best plan that fits their unique circumstance. Outside of that, again, it's going to cover all of the traditional health insurance related services. And then they're community rated. The key difference is that they do leverage individual plan networks. So depending on the state that you are located in and your clients are, there are going to be your Anthems, your Blue Cross Blue Shields, your as your more nationally known carriers, but there's also going to be products like Ambetter or CareSource that are a little bit more regionally based. So there are many different carriers, there's many different plans available. We help you in the full evaluation of if an ICHRA would make sense, and the evaluation metrics that Kelsey and I would go through are the plans going to provide enough value to the employees? Is there going to be enough cost savings? And then we actually help build the strategy of what that dollar amount or what that reimbursement would look like for the employees as well. So here's a quick snapshot. This is a representation of the state of Indiana, of what the annual rate increases look like year over year. The most important lines to look at in this graph are the pink line, which represents Ambetter. Ambetter is the #1 carrier actually the largest individual carrier in the country, the top carrier in the state of Indiana. Anthem is another line to look at. That's the dark blue. But if you notice, after 2020, and kind of the trend that we saw, Ambetter has lived in. So in 2021, they saw about a 2% rate decrease across the board. 2022, another about 2% rate decrease. In 2023, it was about a 1.5% to 2%. And this past year in 2024, it was just over a 1% increase on all of their individual plans within the state. Talk about stability. To be able to go to your clients and say, hey, great news, you're receiving a 2% rate decrease, doesn't exist in the group health insurance world. So that's some of the excitement that we see in the individual plans. And then Anthem, since they re-entered the market, because ICHRA has been so competitive and we see millions of Americans shifting to this ICHRA solution, they've actually seen rate decreases year over year. So from 23 to 24, again, we saw about a 0.5% decrease in their overall premiums in the state of Indiana. So then you might be asking the question, well, this is great, it's unique, and I'm sure you have more questions than this, but we wanted to give a generalized overview of what the ICHRA is doing. The next question is, well, who's an ICHRA work for? Well, I have a lot of different clients, a lot of people that I'm talking to. How do I know if ICHRA is worth the conversation and really worth diving into with my clients? So when we look at who does an ICHRA work for, these are really where we are finding our ideal prospects. And we always laugh, I'm sure in your conversations, no carrier, no health insurance solution has ever asked you for your most challenging cases. Yet that's where the ICHRA can actually work really well. So as we mentioned, a lot of the benefits of the ICHRA being community rated and they're the fully insured plans, they're guaranteed issue. Well, right off the bat, your unhealthy or your high risk groups that have high claimants, high medical utilization, high prescription costs, whatever that might be, can be an absolute home run when it comes to this ICHRA solution. So that could mean it's a large group on a self-funded plan and they have lasered claims on that plan because of their costs are so high. Well, that could also mean they're on a fully insured plan and they might have really high medication claims. They might have a cancer case. They might have a hemophilia case, whatever that may look like. Obviously, any of those significant claims that are driving rates up and creating adverse risk for the carrier are the groups where the ICHRA can make a ton of sense. And because we're taking a step back and saying, well, if you have a group of 50, they're no longer looked at under the microscope of a carrier as a group of 50. We're now dispersing those 50 employees into a pool of tens of thousands, or if not hundreds of thousands of people, which is what creates the rate stabilization that we're seeing in individual plans. And it's also obviously what creates the initial cost savings when we're comparing individual plans to the group environment. In a similar fashion, also we are also mentioning groups struggling with participation, and that could be any participation limits, but usually groups are in that 20, 30, 40% participation. Carriers don't love that. When we can shift them to this market, obviously we're doing away with the need to hit certain participation requirements. This is also a good fit for groups who are just looking to stabilize costs. We're saying, I'm tired of this guessing game. I'm tired of our renewal year over year, this second or third highest line item in our budgeting increases by 10 to 15% every year. I want out of that, and I just want to fix my budget, fix my costs, and not allow employees to go out and purchase their own individual products with that budget. This is a great way to solve that challenge. And then obviously ALE compliance. If you have a group who's crossing over that threshold of 50 full-time employees and they have to offer a traditional group health insurance plan, but it's too expensive, well, the ICHRA can be a great solve for those types of groups who are wanting to remain compliant and not be hit with any of those shared responsibility penalties. So hopefully that gives you a pretty good snapshot and understanding of what the ICHRA is. There are numerous ICHRA vendors out there. Remodel Health, the reason that we have built such a good partnership with AgentLink and many of the top health insurance agencies across the country is because of our service solution. We take more of a high touch point, white gloved approach, and I'm going to turn it over to Kelsey to really help you understand our involvement through this process, to do a lot of the heavy lifting and hand holding to make sure it's a good experience for your clients, but obviously at the end of the day, make sure their employees are very well served through this solution.
Perfect. Thank you, Matt. Yes, as he mentioned, there are ICHRA solutions popping up left and right across the country, hoping to earn your business. And we want to really show you today why Remodel Health is the way to go. And really that comes with our service model that we've designed. So ICHRA vendors are typically known to be, a technology solution. We're inviting employees onto a platform to purchase these individual benefits. What we find at Remodel Health is that it's much more than that. It's having those personal advisors that employees can meet with one-on-one over a Zoom call to discuss their individual needs. What prescriptions are they on? What providers are really important to them to have a network? And then after they've enrolled in those plans, that assigned customer success representative who is walking with them all year round as they receive a first medical bill or a claim didn't get accepted and they really want to understand why that is. That assigned customer success representative comes alongside an HR director, an employee, and also you as the broker as well. So we know that in this landscape, employees could be enrolled on such a variety of plans. So where you are traditionally used to providing resources and support for one plan, now employees are enrolled in a variety of plans. So our customer success team is there to assist you as well. And then they're also there to assist with any of those administrative pieces and really become an extension of the employer's HR team. And then something that cannot be undervalued or overvalued enough is our list bill. So all of these individual products, as we've discussed, create their own individual premiums, and we want to streamline that for every employer that we serve. So employers receive one list bill from us each month with a breakdown of their total cost, all-encompassing employee premiums. So employees are not making these premium payments individually, and that really guarantees that they are remaining insured for the year. They're not missing a payment. They're not choosing to opt out randomly throughout the year. This ensures that the employer's reimbursement dollars that they're offering in that budget are being used to help purchase health insurance year over year, because we are making all of those payments for employees throughout the year, and this is all handled through payroll deduction. Definitely an important part of the solution. Then as well, we have an awesome online shopping experience. So employees do have the option to plug in providers in our search and verify if they're in network. And I'll talk a little bit more about how we structure the online shopping experience here shortly, just so you can get a better visualization of that, since it is such a key part of how an ICHRA solution operates. Additionally, we have an awesome implementation strategy and team that back each of our groups. So when you land an ICHRA deal with Remodel Health, each group is assigned a designated launch coordinator And that person is there to walk alongside the group, make sure that everyone who's interested in coverage is getting enrolled. And they're also there to make sure all of the HR boxes are checked. So all the administrative paperwork gets signed to make sure that this is a compliant solution. Another key part of that team is just acknowledging that this is a change for this employer. So, and maybe for you as well at first, understanding what this process looks like to implement an ICHRA, we want to make sure that employees feel supported and that change management is really a part of what we're rolling out to employees, since it is such a new benefit and employees have really historically never had this a need to educate themselves on employee benefits, because you're used to just receiving that 1 or 2 plans from your employer and just saying, okay, I guess this is it for the year. So we understand that there is some education that comes along with that. And then as an added benefit, every employee who enrolls in a plan through this solution receives Teladoc as an added bonus. And that is a $0 copay benefit. So Teladoc is out there, or there's other telemedicine tools where a copay does apply. With our added solution that is added to each employee's plan, this does offer them $0 copays to access telemedicine, just to make sure that that is at their fingertips. The need to seek care is accessible for them and their family, and helps the employer as well make sure that they are showing up for work, especially for those minor things that maybe we just need to get a prescription, and that can all happen over the phone and there's no missed work or commuting time to make that happen. So now I'll share a little bit more about our shopping experience. So when an employee logs in and completes their checklist of steps, they're going to see one plan displayed as a recommended plan. And as Matt mentioned, in the process of implementing and strategically planning this ICHRA solution, we help to evaluate what plan most closely aligns to what the group is currently doing, or if they're a new to benefits group, we also want to help make sure the employer feels comfortable with the plans that they are reimbursing for. It's not just here's $200. What does that $200 buy my employees, or what does that $200 buy me? So we're strategically building around a plan design that's traditionally or likely close to what the group is already doing. And when an employee logs in, they're going to see that plan right off the bat. What this does is it helps the employer or employee feel comfortable with that plan that they're going to see. It's going to be similar to what they've been doing before, hopefully. And so it just adds some peace of mind and takes out some of the complexity of all of these plan options that I now have access to. And the benefits of this we see in year one, 60% of employees are likely to pick this plan. And then the additional 40 might choose to shop for a different plan or seek an advisement. So that just means, gives you some peace of mind as a broker. Not every single person is going to feel compelled to meet with that benefits advisor. Of course, that is available to everyone, but not everyone is going to need that. Some employees do feel comfortable either just selecting the plan comparable to what they were offered before, or going through that shopping experience, plugging in their providers. I mean, we know that a variety or many employees on a plan are healthy today, and so they're just looking for a backup plan. You know, if something happens to me this year, I want to be insured, or my employer's covering a great portion of it, so I want to have that plan. So many of them are going to select this plan. And then in year two, we do see that this increases to 80%. So that just speaks to the satisfaction employees have when they select their benefit, that only 20% are really looking to make a change after the first year, and the other 80% feel content with the plans that they've selected. This is an example of what that shopping experience will look like for employees. So they're going to see some plans when they log in. They'll see the family members that they're shopping for. And then these teal numbers over here are going to be the cost after their employer portion. So this is the cost to the employee over here. So on this strategy with these higher numbers, it's likely that the employer's just covering the employee, and then this person has opted to add family members as well. Then over here on the left, you can also see the budget that's being made available to them. On the left, you can also sort by a variety of options. So if you've narrowed down that you are only interested in Ambetter or CareSource, those are the providers or carriers that have your providers and network, you can just search for those carriers. You can also search by metal level, so the quality of the plan, bronze, silver, gold. And then below there, you can also search for HSA eligibility or plan network. So PPO, HMO, those types of options are also available for an employee to sort through and make that plan decision. So finally, what does this customer experience look like? So I want to spend our last few minutes before we dive into some questions talking through what does this look like for an employee? What does this look like for you as a broker when you invite us into that strategy decision? So typically what we're doing is you're sending that quote to Agent Link and we're evaluating it for you and then connecting to review the proposal together. That's when we really enter into the sales support portion of the strategy. So then we're happy to join you in the meeting with the client to review this together and really just to be that subject matter expert for you on our solution, as well as just the ICHRA model as well, answer any of those compliance questions. Then after we've reviewed it with the client, we're moving into implementation. So we do require a 30-day implementation on average. If you have a much larger group, we might look at a longer timeline. But for your standard group, we're looking at about 30 days required for implementation. And that just goes back to that, making sure we can provide that white glove service for the employees, making sure all those admin boxes are checked and the employees are able to have enough time to make that individualized decision. So we're introducing the admin to that launch coordinator, hosting an all-employee meeting, and then from there, the employees are invited to either shop in our software or schedule that advisement. After that is complete, we typically review any updates that might come with how payroll is managed with this solution. Typically, there aren't a lot, but we find that there's a lot of value in just looping together with the admin at the end of the month to review enrollment and make sure they feel confident about what they're implementing in payroll. From there, the team moves into our ongoing support. So that's that designated customer success representative to answer any of those ongoing questions an employee or an admin might have. They're also responsible for making sure that you are aware as the broker partner of any escalated concerns to be aware of. So maybe any enrollment issues that have come up. And then as an added layer of support, we also have an account management team or designated account manager that's assigned to each group to assist with any compliance concerns that the group might have, or just to make sure that those 1095Bs or 1095Cs are being filed each year for the group. So this is just an example of some real life employees who are a part of that support team that really wraps around this ICHRA solution and provides you additional support as our broker partner. So that launch coordinator, those benefits advisors. A great question that we get from time to time is, what do new hires have access to? Well, our customer success representative sends a welcome email to them, and then they're invited to shop or schedule an advisement throughout the year as well. So this advisement is not just for the initial onboard, it's for new hires, it's for renewal each year. The employees have access to this team. So maybe they've experienced a life change that's really made them want to evaluate their benefits. That team is there to provide that support. And then Chris here from our customer success team is a great example of someone who could be your employer's customer success representative. And employers really get to leverage that as much or as little as they want. So we have some employers who are reaching out weekly, and we have some employers who might touch base once a month just on some smaller ticket items. But I know I can speak to a customer success representative on our team, Lindsay, who had a baby, and she received a onesie from one of her clients, just showing that support for her. And so that relationship really does develop both ways. And it's great to see how our customer success teams just comes alongside the employers that they serve. And then, like I mentioned, that account manager. So Ben here is our director of account management. And that team is really there to provide support, especially for groups who have that added compliance needs, the groups over 50 who have to do some additional reporting. We want to make sure that you feel confident with the reporting that needs to happen there. They're also going to provide support for you as the broker partner as well, just to make sure you feel resourced at renewal time as well. So they're going to assist with those renewals, make sure that the client is happy and supported throughout that experience. Some expectations for our customer success team. So service expectations, employees throughout the year and admins and you have access to our care@remodelhealth.com email. That's going to be the best way for employees to reach out. It is a ticketing system. They get assigned to each customer success representative accordingly, but that just makes sure, one, that we're able to monitor that team to make sure they're meeting our standards, which they always do, and two, to make sure that if there's any vacations that come up, you know, our customer success team might want to take a day off from here to there. So make sure that your employer doesn't experience any lapse of support during that time. So here's just some great examples of how that team provides support. You can see their average response time. We don't treat this team as a call center. So because it's a designated point of contact, they might schedule some times to connect with you. They are always available during business hours. And as you can see, the support that they're responsible for providing, carrier advocacy, we have at Remodel Health developed some great carrier partnerships across the nation. And so that assists us with making sure those escalations happen with those carriers when problems arise. So finally, wanted to talk through what's next for you. So we've talked a lot today about the ICHRA solution. What is it? Maybe you're in the room and this is your first time hearing about it, and you're going to walk away and do some additional research on it yourself and maybe look through your clients or your book of business that you have today to see if there are any employers that might be a good fit for that. So we'll talk through next steps, what Remodel Health needs in order to quote an ICHRA for your group. And then we also have a special agent link incentive and some other upcoming events we wanted to make you aware of. So to quote this solution, you will send these 3 things to Agent Link for quote. So you can see here that we would need a census with that demographic information, a summary of benefits for their current plan and the current and renewal rates. And so really that just helps us make sure if they do have a current benefit that we're creating an apples to apples strategy to make sure that the ICHRA solution is competitive for the group. If it's a new to coverage group, we just need that census and we can kind of take it from there. If you have any advice or if you've learned of the employer's budget, we can use that to build a strategy around that for you. So that's going to be the 3 things that we would need to quote the solution for you.
Just to add to that briefly from a timing standpoint, we prefer to get that information as soon as their renewal gets processed because we do ask for a 30 to 45 day lead time from the moment that an employer makes a decision in order to move forward. So if you sent us the census today for a May 1st effective date, unfortunately, we're beyond that 30 days to be able to implement that group. So typically about 60 days in advance of their actual renewal date would be the ideal timing to get these documents in order for us to process them, run the quote, help present them to the employer with your support, and then obviously allow that decision timeline to give us that 30 to 45 day window.
Perfect. So that is great for next steps. Also in Indy, if you're local or you're interested in coming in, we have an upcoming conference in the Indianapolis area from May 22nd to May 24th. If you know much about Indy, it's an exciting time. May is the month to be in Indy. This will butt up against race weekend. So the Indy 500 will be that following Sunday. And as a part of your registration, you actually will receive a ticket to Carb Day, which is the big Friday event leading into race weekend. So this conference starts Wednesday with a welcome event. Thursday, all-day content conference for you around broker partnerships, kind of TPAs that you might want to have in your network, as well as some other HR tooling and networking opportunities, impact dinner that night, and then the fun Carb Day event on Friday. So a great opportunity to connect with other Agent Link brokers, or just build your network of other brokers, HR professionals, some carriers. Partners will also be in attendance at this event. Great opportunity to meet our team as well. You can use this code BROKER99 at checkout to receive that ticket for $99. I believe right now the ticket price is actually $399, so that's a great deal for you. It is at the Alexander Hotel, and I am told that our room block, so if you would like to also book accommodations, our room block closes next Monday. So be sure to get on that this week. If you're interested in attending, we would love to see you there and engage with you more during that time. Finally, you might be wondering, oh, what's in it for me? I know we talked about incentives, so this is the first of two I wanted to roll out there for you. So when you enroll 50 lives with us, you get a dinner on us at Remodel, and the incentives increase from there. So we will make sure that these incentives are sent out to Vince and Melanie and her team so that you know what to experience. So I'll save all the information for you there, but just wanted to give you a glimpse into some incentives that we do offer here at Remodel Health. The rest involve fun trips as well. So we want to make sure that you feel incentivized to work with us and bring us business and really reap the reward as well. Of course, we haven't spent a ton of time talking about this, but there is also a PEPM compensation that you would earn on each group that you bring us as well. And that is set at $25 for you as the broker, with an additional part built in for Agent Link. So just wanted to make sure you were aware of that as well. Today's incentive is as follows. So the top 3 census requests that we receive, so from 3 different agents, would be eligible for these 3 prizes. So the first agent that we receive to bring us a census with 25 enrolled employees would be eligible to receive a $100 gift card and free AIM registration. This would just be for the conference, accommodation separate. $100 gift card plus free AIM conference registration when you bring us the census. And then as follows: second place, $50 gift card plus free AIM registration. Third place, free AIM registration. So bring us those censuses. You will send all of those census requests or proposal requests to Vince at Agent Link, and he'll be monitoring those as they come in. And the contest will end next Friday, April 26th, for an effective date of July 1st or beyond. So bring us those today. Matt, anything to add on that?
No, just clarity, not top 3, it's the first 3 censuses that come in that meet those requirements. So the first 3 forms that come in, it could be today, it could be next week, but yeah, whoever sends the 3 censuses with all the information we need, the summary benefits and the renewal or current premium rates, yeah, as they come in, we will be tracking that from a time stamp to understand who would fit the top 3 here.
Perfect. We do have a few minutes for questions. Melanie, has anything come in on your end that would be worth covering together?
Yeah, there's actually quite a few. I was excited as they started rolling in. There's some great questions. The first, what is the minimum size and minimum participation rates?
Yes, great question. So minimum size, we simply charge a minimum fee based on 5 employees. So if you have a group less than 5 employees, we're happy to quote it, but our fee would be charged based on 5 employees. That also means the broker would get comped on 5 minimum lives. So other than that, though, we can go lower, but typically we want to see at least 5.
That's the minimum. We start to see the ICHRA make sense a little bit more financially once you exceed 10 employees. We do serve many groups under 10, but once you start to see the more employees participating, the numbers start to make more sense the larger that you get as well.
Perfect. So there's no participation requirements either. It's just, it works the best at that 10 and up.
Right,
Correct.
exactly.
Yep. And when we say minimum 5, that is 5 participating, not 5 total employees, because our service fee is built on the 5 participating employees is what we would bill for.
Gotcha. And are the plans available for the employee to enroll in? Are they the same as what they would find in the marketplace?
Yes. Sometimes we also see additional offerings when we enroll direct with carriers. So for example, Ambetter offers different plans off exchange, so direct with Ambetter than they do on exchange. But then CareSource, Anthem, Blue Cross Blue Shield, we're often seeing that those are the same plans, but our pricing is always going to be the same as what they would see if it's on exchange, apples to apples. We don't upcharge or anything for them to enroll through our site in those plans.
Perfect. And I think you touched on this, but there's a question about how you work with the bad health. And I think you kind of touched on that because it's like more of a marketplace. They can't discriminate against the health, but I'll let you explain. I was actually paying attention. This was great.
Yeah, Matt, do you want to reiterate that?
Yeah, absolutely. So the way that Remodel Health interacts with those people that have challenging health risks, we actually, as Kelsey mentioned, we have 2 different avenues in which people can select their plans. People can go on their own through like a self-shopping experience. Those are more your go-getters. Not everyone shares that mentality when they're going to shop for their health care. The other avenue would be scheduling and advisement with a one-on-one benefits coach. Anyone with high medical costs, significant prescriptions, upcoming medical events, whatever that may be, we always highly encourage them to speak to an advisor so that we can help them navigate the best individual plan. Not because their plans are going to cost more, because we want to make sure they're really well cared for. Because obviously if they have those high costs, we want to ensure they're in a plan that covers those medical needs well. The nature of individual plans cannot discriminate against those people. So you could have 2 40-year-old employees who live in the exact same zip code, have the same household size, same ages. One of them could have $50,000 in medical costs. The other may not have been to the doctor for the last 20 years. They have the same access to the exact same plans at the exact same rates. They are not in any way health underwritten, not discriminated against. It is solely demographically rated when you are shopping for individual plans.
Perfect. The next question, can you offer ICHRA with MEC plans?
Yes. So there are classing options. We didn't get into that today. That's kind of ICHRA 102 maybe. So you can class employees. Some of the most common that we see are hourly and salary splits. You can also run an ICHRA alongside a MEC or alongside a group plan as long as it's classed according to the 11 ICHRA classes. So you could offer a traditional group plan to your salary employees, and you could offer ICHRA to your hourly employees, or you could do something more like an ICHRA to your salary employees and a MEC to your hourly employees. So you can't offer a MEC and an ICHRA to the same class of employees, but you can run it alongside or have it replace a MEC.
Fantastic. And can you offer different dollar amounts for different age groups?
Yes.
Within the employee pool?
Yep, so that's going to be the main way that we help you strategize this solution. we typically do a percentage model around plan costs by 1 or 5 year age bands to make sure that, because these plans are age rated, we want to make sure that the employer's reimbursement also kind of aligns with the price of those plans.
The only requirement there is that, and that's fully compliant. You're able to give varying amounts based on age brackets. And this is a little bit more nuanced, but you just have to make sure they call it a 3-to-1 ratio. So you cannot give your oldest class of employees, which is oftentimes your 60 to 65-year-olds, you can't give them more than 3 times your youngest class of employees, which is usually that 20 to 23-year-old. So as long as it fits within a 3-to-1 ratio, you have the full ability to give varying dollar amounts to employees.
Fantastic. That's so cool. And will this accommodate minimum required employer contribution?
Yes. So typically on our census, we do ask for employee income. Sometimes we do that as more of like a second pass evaluation. So some employers or brokers don't want to give that information right off the bat. Of course, it's always helpful, but maybe we can do a second pass once the group expresses more interest. But our software will account for affordability metrics in the individual space. That's based on the lowest cost silver plan in the area. So making sure that the employee can afford to purchase that lowest cost, up 50% of that lowest cost silver plan.
And that would only be relevant for your large employers over 50 full-time eligible. For your small employers under 50, there's no contribution requirement from the employer. I know some group carriers require a 50% of the employee only. Where we see the ICHRA make the most sense is for employers who have a strong desire to care well for employees and cover a significant portion. So if you have an employer that says, well, I want to offer an ICHRA, but only cover 10% of the employee's cost, just logistically, it may not make sense or financially for the employees. So there's not a technical bottom dollar or minimum requirement that they have to contribute for small employers, but it oftentimes makes sense. The more generous the employer is towards the employee contribution, oftentimes makes the most sense for a group utilizing an ICHRA.
Fantastic. Great questions, everybody. It's always fun when there's interaction at the end. I love this. One last question just came in. Is it possible to schedule Zoom calls with Remodel Health and our groups to discuss how you can help? We have never implemented ICHRA and have a group it may be helpful to, but not sure how to approach this change with the group.
Love it. Yes, that is Matt and I's job, is getting on calls with you, our broker partners, and your clients to help be your subject matter expert on this solution. So that's certainly one of my favorite parts about what I get to do. So your next steps would be to get us that information from the group so that we can generate a proposal for you. And then typically we're jumping on that call, explaining what ICHRA would mean to this employer, how the numbers are looking, and kind of our reimbursement strategy we recommend for them. And then we're kind of getting their feedback, learning more about them as a client or what their goals are, what their budget restraints are, and then kind of going from there to build either some new recommendations, updated recommendations, or moving toward that contract from there with the broker's engagement as much or as little as they want to be. We want them to be on every call, but once they're implementing with us, there's no requirement. We just think it's great for them to kind of see how the process works as well.
Fantastic. And what about employees that are over 65? Do you guys help them with their Medicare options as well?
Yeah, great question. So ICHRA is unique in that employers can now offer a pre-tax budget to employees to purchase their Medicare Part B and supplements. So, I mean, typically it's like taboo to offer these employees dollars to get off of your group policy. And in an ICHRA, in the individual landscape, employees are not really allowed to be on these individual products once they reach 65. So they will be transitioning to Medicare as a part of the transition to the ICHRA solution. And they're offered a budget that far exceeds what they would need to purchase those supplements, because based on the ICHRA standards, as we understand them, they're offered the same budget as a 64-year-old. So since these plans are age rated, we know that's probably going to be a substantial amount, and they rarely need that full amount to purchase their Part B and supplements. So your Medicare eligible employees typically become your happiest and your cheapest in this transition, which is once again kind of unheard of. And we at Remodel Health do have a team of Medicare advisors. I know a lot of agents either like to do that themselves or have someone on their team who also does that. And so we welcome that. If you are someone who does Medicare enrollments, you can continue to do those. And this would just be a special enrollment for that transition.
Perfect. And this wasn't a question, but it popped into my head as you were explaining that. Would their dependents, if they have a spouse maybe that's not 65 yet?
Good question. That's another big reason that people over the age of 65 don't move off of group policies, because they have dependents. So with this solution, you can still purchase an individual plan kind of through your employer-sponsored product for your dependents. So say you're the employee and you're 67, your wife is 64, you could purchase that individual plan through our software, potential, depending on the strategy, receive a reimbursement for your spouse, and both of you would kind of be incorporated into our solution. That spouse's plan premium would still be deducted through payroll. So yeah, it's a great option. If you have dependents, they would still be covered, incorporated in this solution.
Perfect. And there's still a lot of questions coming in, and I know that we are getting short on time, but I'm going to do one last question. But no, if you have typed in a question here, I'm going to forward it to Vince and Kelsey and Matt to make sure all the questions get answered. Or if you guys want to stay on longer, if people need to hop off, we can try to get through them, however you guys want to handle that.
Yeah. We have a hard stop at 11, so we'll probably just have to take in the remaining questions via email.
Perfect. And just so everybody knows, I will also be sending out a recap with a link to rewatch the webinar if you want to. And all of my contact information will be on there, as well as Kelsey's and Vince's for proposal information. If you want to request a quote, all of Vince's information will be on there. And if you have other questions, feel free to shoot them our way. We love it. But one other really good question, do you guys help with HSA options?
Yeah, great question. So of course, there are plans in the individual market that are HSA eligible. Typically, we're not putting in a whole employer HSA solution with this model, because not everyone may select an HSA benefit. We do have vendor recommendations that we can make for you if you just want some assistance with that, or a local bank. I know a lot of broker partners also have their own recommendations that they like to make. So just like you, we have our own vendor recommendations as well. But typically you're not putting in so much of a whole employer strategy around HSA with this, and not everyone may choose an HSA eligible product.
Perfect. Thank you guys so much. I know we're quickly approaching the 11 o'clock hour, so I just want to thank you both so much. It was wonderful content and very engaging. As somebody that this was a brand new concept to me, I found it very interesting and engrossing. So I really appreciate you guys taking the time to explain it to all of us.
Of course, we're glad to do it, and we look forward to connecting with many of you this year as you come up with groups that this might be of interest for.
Absolutely, and get those quotes in so you can get some of those free little perks and some of the incentives that they're offering.
Yes, here they are again. All right, have a great day.
Thank you guys so much. Have a great day.
Thank you.